Hello everyone, welcome back to Triangles of Neck. So in previous session we saw the subdivisions of anterior triangle. So today we are going to continue carotid triangle. So carotid triangle is this part of the triangle is the carotid triangle, where it is very important clinically because most vital structures in the neck are running in the carotid triangle. So that is the reason it is carotid, because it contains carotid artery, common carotid, internal and external carotid artery. So let us see further. So the roof of the carotid triangle, it is formed by the skin superficial fascia, and also we can see the platysma muscle here. The platysma muscle is supplied by cervical branch of facial nerve, and also the transverse cutaneous nerves of the neck and investing layer of deep cervical fascia forms the roof of carotid triangle. So the roof is formed by the skin, superficial fascia containing platysma supplied by cervical branch of facial nerve, transverse cutaneous nerve of neck and investing layer of deep cervical fascia. The floor of the triangle, we can see this part forms the floor. So it is the deepest aspect of the carotid triangle forms the floor, formed by the muscles of middle and inferior pharyngeal constrictors. So this is the middle and down one is the inferior constrictor. So inferior constrictor, we can see it is formed by uh, thyropharynges and cricopharynges. So we can see the thyropharynges majorly forms the floor of carotid triangle. And also there is a membrane here between the thyroid and hyoid bones, thyroid cartilage and hyoid bone. This membrane is called thyrohyoid membrane, and we can see it is pierced by the internal laryngeal nerve and superior laryngeal vessels. So these structures forms the floor of carotid triangle. So I repeat: middle constrictor, inferior constrictor, thyrohyoid membrane. Let's see the blood vessels, that is the contents of carotid triangle, starting with the blood vessels. So we can see the common carotid artery bifurcates within the carotid triangle into external carotid artery and internal carotid artery. So the bifurcation present at the level of thyroid cartilage anteriorly and at the level of C4 cervical level. So at vertebral level C4. So vertebral level C4, the common carotid artery bifurcates. At the site of bifurcation, if we touch and feel, we can feel a nodule within the wall of common carotid artery, which is called as carotid body. Carotid body contains the receptors, which are the chemoreceptors. They check the chemical nature of the blood. Chemoreceptors it contains, which are richly supplied by glossopharyngeal nerve. And the dilatation of the near the bifurcation is called carotid sinus. Carotid sinus is a baroreceptors. It contains mainly the baroreceptors which detects the blood pressure of the blood, and it is also richly supplied by glossopharyngeal nerve and spinal accessory nerve and some sympathetic plexus. And we can see the common carotid bifurcates at the level of C4, and internal carotid artery won't give at any branches, it runs upwards towards the carotid canal, whereas the external carotid artery we can see several branches which are getting origin within the carotid triangle. So totally the external carotid artery has got 8 branches. Initial 5 branches are given off in the carotid triangle. So the 5 branches are ascending pharyngeal artery, which is meant to supply the pharynx. Ascending pharyngeal, you can see a little part of it running up. Then an artery which is descending down is the superior thyroid artery, which is meant to supply the thyroid gland, superior thyroid artery. And we can see an artery here going towards the tongue, which is called as the lingual artery. This is the lingual artery, and above the lingual artery, the other artery is the facial artery, which is winding round the mandible and coming towards the face, facial artery. And posteriorly we can see the occipital artery. These are the 5 arteries which are given off in the carotid triangle. So ascending pharyngeal, superior thyroid, lingual, facial and occipital arteries are given off in the carotid triangle. Next, about the veins. The major vein present in the carotid triangle is the internal jugular vein, And the internal jugular vein and carotid arteries and the vagus nerve, these three vital structures are covered by a sheath which is called as carotid sheath. And the vein is here, which is receiving the tributaries of so in the carotid triangle, the tributaries are facial vein, lingual vein, and superior thyroid vein, which drains into internal jugular vein. These three are the tributaries which are draining into the internal jugular vein. And let's see the nerves which are present in the carotid triangle. We can see here the blue one is the internal jugular vein, the red one is the common carotid which is dividing into external and internal carotid arteries, and in between the sandwiched yellow ones is the nerve, and the nerve which is descending down is the vagus nerve. And vagus nerve gives branches like superior laryngeal nerve. Superior laryngeal nerve is a branch of vagus which terminally divides into that is internal and external laryngeal nerves, which internal laryngeal nerve supply the sensory upper part of the larynx. External laryngeal nerve supplies the one muscle of larynx which is called as cricothyroid muscle of larynx. And superior laryngeal nerve and also the spinal accessory, we can see the spinal accessory nerve which is mainly content of posterior triangle. We can see little part of it in the carotid triangle as well. And the one which is looping here superficial to both external and internal carotid arteries, this nerve is the hypoglossal nerve. This nerve is the hypoglossal nerve, 12th cranial nerve. So these are the nerves located in the, and also the sympathetic chain. The deepermost structure is the sympathetic chain, is present in the carotid triangle. So the contents again, I'll repeat: vagus nerve along with its branches like superior laryngeal nerve, which is terminally dividing into external and internal laryngeal nerves, external and internal laryngeal, and carotid triangle also contains spinal accessory, hypoglossal, and sympathetic chains. So these are the nerves located in the carotid triangle. Next, about the carotid sheath, the condensation of the deep cervical fascia forms a sheath around the vital structures in the carotid triangle, that is the internal carotid artery, internal jugular vein, and vagus nerve. These three are covered by a sheath called as carotid sheath. And below, after crossing the neck, the sheath is continuous with the pericardium of the heart inferiorly in the thorax. And the main contents, we can see the common carotid and internal carotid arteries are the contents. External comes out of the sheath, it pierces the sheath and comes out. And internal jugular vein and vagus nerve which is in between. And also sometimes deep cervical lymph nodes which are present along the internal jugular vein. So these are the contents of carotid sheath. And the carotid sheath anteriorly related to a loop of nerve which is called as ansa cervicalis. Ansa means a loop. So a loop of nerve which is present within the anterior wall of carotid sheath is ansa cervicalis. And it is crossed by glossopharyngeal, hypoglossal, and spinal part of accessory nerve. So above the carotid sheath is crossed by glossopharyngeal 9th, 12th hypoglossal, and 11th spinal accessory nerves. So that is about the carotid sheath. So the lymph nodes which are located in the carotid triangle are deep cervical lymph nodes which are along the internal jugular vein, present within the carotid sheath and outside the carotid sheath, and which includes jugulodigastric and jugulohomohyoid group of lymph nodes which are the principal lymph nodes of head and neck region. So this completes the carotid triangle along with its boundaries and contents, and also the structures forming the roof and floor. Thank you.